A fast-moving measles outbreak is spreading across multiple U.S. states. Hospitals are reaching capacity, supplies are running low, and communities are facing uncertainty about what's next. Today, we'll talk about what preppers need to know to stay informed and ready. Welcome to Preppers News, your channel dedicated to practical prepping and disaster preparedness. I'm Elijah, and due to an injury that makes my voice hard to understand, I'm using a computer-generated voice to ensure clarity. In this video, we'll cover the latest developments on the measles outbreak, discuss its impacts on communities, healthcare systems, and supply chains, and highlight the specific risks preppers need to monitor closely. The ongoing measles outbreak is currently affecting 8 areas across the United States, including Alaska, California, Georgia, New Jersey, New Mexico, New York City, Rhode Island, and Texas. As of February 20th, 2025, the CDC reports 93 confirmed cases nationwide. The majority of these cases, 90 in total, are concentrated in Texas, particularly in the South Plains region. This marks the most significant measles outbreak Texas has seen in almost 30 years. Although the numbers elsewhere remain relatively low, health officials remain concerned about the potential for wider spread due to the highly contagious nature of measles. Schools and daycare centers are key points of transmission, contributing to rapid local outbreaks. While authorities are responding with targeted vaccination programs and increased public advisories, many residents remain skeptical about relying solely on official sources. As preppers, it's essential to closely track the developments in Texas and the other affected regions to better understand potential impacts and stay ahead of any wider disruptions. Communities across the affected regions in Texas are experiencing significant disruptions due to the ongoing measles outbreak. Several private schools have temporarily closed to prevent further spread of the virus, impacting students and families who must adjust to sudden changes in their routines. In addition to school closures, public health officials have issued warnings about potential exposures in public places. For instance, a resident from Gaines County who tested positive for measles visited Texas State University and a local restaurant in San Marcos on February 14, potentially exposing others to the virus. Health authorities are actively reaching out to individuals who may have been in contact during these times. The outbreak has also led to increased strain on local health departments, which are working diligently to manage the situation despite limited resources. Efforts include setting up mobile testing units and providing prophylactic treatments to those exposed, especially infants too young for vaccination. As preppers, it's essential to monitor these developments closely. Understanding the local impact of the outbreak can help anticipate potential challenges, such as healthcare resource limitations and the need for community support during such public health crises. Hospitals across Texas are already facing significant pressure, even before the current measles outbreak began. Many medical facilities report high occupancy levels and ongoing staff shortages, especially among nurses and critical care personnel. According to the Texas Hospital Association, nearly 2/3 of hospitals in the state are operating at reduced capacity due to staffing challenges. With measles cases increasing, particularly among young children, health officials are concerned that any additional rise in hospitalizations could further strain an already stressed healthcare system. Any increase in cases requiring medical attention could disrupt normal hospital operations and make accessing timely care more difficult. Right now, there are no reports of widespread panic buying linked to the measles outbreak. Stores are operating as normal, and essential goods remain available. However, if the outbreak worsens or spreads to more states, that could change. Public health crises often lead to increased demand for medical supplies, including over-the-counter fever reducers, masks, and disinfectants. If more schools or workplaces shut down, grocery stores could also see increased buying as people prepare for potential disruptions. While there's no immediate concern, preppers should stay alert. Keeping an eye on local supply chains and staying ahead of potential shortages ensures you're ready if the situation takes a turn for the worse. There are specific signs that preppers should watch closely in the coming weeks. First, pay attention to whether additional states declare public health emergencies, as these announcements signal increased severity and a potential escalation in supply shortages. Second, track community responses closely. If more school districts close and businesses move toward remote operations, expect further disruptions to daily routines and local economies. Continued or widespread panic buying is another indicator that shortages of critical items may become common. Finally, stay aware of developments in healthcare capacity. Hospital systems at or near their breaking points can quickly transform a localized outbreak into a much larger crisis, making access to medical care increasingly difficult. By remaining informed about these indicators, preppers can better anticipate how the situation may evolve, staying ahead of potential problems before they directly impact your family or community. If you found this video helpful, please take a moment to like, share, and subscribe for more news and global events with a prepper's perspective. Thanks for watching, stay safe, and I'll see you on the next one.